I was diagnosed with multiple sclerosis in 2007, and it is secondary progressive multiple sclerosis. It has been gradually getting worse, my symptoms. I'm a retired physician. I practiced infectious disease for 15 years, up until 2011, though I was diagnosed in 2007, and I had to retire because my symptoms got worse, and I retired in 2011. I was initially started on injectable medications, and I went on oral medication since 2013, and it has been helping some, but my symptoms are getting worse. So I decided to do stem cell transplant. I looked up how stem cells can treat multiple sclerosis, and I heard about Stemedix when I was looking into that information. I've been getting very interesting articles sent to me on the web, and I read a lot about it, and it looked like a very safe procedure. In the sense, it is your own cells, so you don't have any issues with graft versus host disease. The second thing is they can get stem cells from the bone marrow and other tissues in your own body, but they don't make as many stem cells that is in your adipose tissue. So it is a much bigger number. So the bigger number hopefully will get to the sites where you actually need the help, which is the lining of the nerves, and which is called myelin, as we all know. And the myelin also, to look in great detail, the myelin also is some kind of a fatty tissue. So putting two and two together, it's your own fatty tissue you're taking out and getting the cells out and injecting it back into your system. So your fat cells are just, in certain ways, the stem cells from your fatty tissues just being redirected to the right place now, kind of situation is the way I looked at it. I'm from Philadelphia and in Pennsylvania, and we have lived there for almost 15 years now, and we had to travel to Florida, which is not a problem, and we did that because it's a shorter flight, 2.5 3 hours, and it's comfortable, and they're very accommodating, and I have had no problems staying there. The breakfast is good, which really helps. You know, I'm very happy with the facility. It's extremely clean, and we were very impressed with how neat and clean this facility is. And as far as the staff concerned here, they were extremely professional and very, very thorough. I was very impressed. And physician, he explained all the questions I had. I can be very picky and several questions because I'm a retired physician myself, but he was extremely patient and explained everything to me thoroughly. The whole situation was extremely transparent. The physician was very kind enough to explain this even before I came here for the procedure. And that is not something other stem cell places that I had checked out were willing to do. And I felt Stemedix, they were thoroughly transparent right from day one. There were no if, and, or buts. So I was very happy with Stemedix and how transparent they were with the whole situation. Yeah, I know there is issues with HIPAA regulations, but if they get permission from the person, they can always say, hey, can you please talk to so-and-so and they want to talk to you about so and so situation, and all they have to do is get the permission. And that truly happened with Stemedix. The other stem cell centers that I had tried, they were like, they can't let me even hook up with another patient even with permission, and that is extremely disturbing. And knowing, though from the days of my practicing as a physician, though I know about the HIPAA regulations, I know with permission you can ask the person to talk to another person, so it is crucial. That was crucial for me to hear from another patient, yes, this is a procedure that is worth going through and didn't have any complications, and that patient was very happy with the treatment that person got and the improvements that person had seen. And that person is also in the same situation. It is a secondary progressive MS that person I talked to had. So that was very comforting. The biggest situation for me is fatigue, and I have some right leg weakness, and the fatigue has slowed me down a lot, and the right leg weakness, between the two I have significant amount of slowing with even just walking from point A to point B, and I slow down everybody else around me in the process. So that is my major concern, and that if that situation is helped even by 20 to 30% improvement, that will be big for me. The difference I have been noticing is very subtle, and that is actually my right foot and my right leg. I could not independently lift it. Like even sitting in a chair, I couldn't do this much. I had a lot of difficulty, so I'm able to do this much now, which is good. And also, lift my toes up and go on my toes. So this is a very subtle finding that a lot of people may not notice, but I was able to notice just after I went back to the room yesterday after the procedure, and I was thinking, okay, what are all the things I need to see if I have to see improvement? And I said, okay, let me see how my foot is feeling and how much I can move my right side of my leg and the right foot, and that was really helpful and encouraging to see that much of change. The left leg is the normal side, so I'll show you how much I can do with the left leg, but the right leg I could not even do what I'm going to show you now. I couldn't do it at all, so I can do that much, which is helpful. I couldn't do this at all. Like when you go for physical therapy, they say you have to learn to tap your toes, that will strengthen your leg. I couldn't even do that. So even lifting the heel up, just couldn't do it before.